Yeah, okay. So in today's session, we'll discuss some important topics from quality control management. Okay. Exam briefing session I have recorded. Okay. The briefing will be uploaded. Okay. Just check the playlist. In all the playlist, exam briefing will be uploaded. Okay. You will have quality control the quality control students will have quality control playlist. Today at the end of that playlist, exam briefing will be there. So please check that. Okay. Quality control management important topics. Sample question discussion also we will do next week. Okay, closer to the exam. So you will retain some information on how questions will come. It will kind of be a revision for you. So study your textbook properly for the next class. Okay. New students just see how the sessions are. The existing students who are preparing for the September exam. Okay, for them try to read the textbook at least twice this week. Okay, you will find it easier to answer the questions. Okay. So page number has been put here. Those who have the textbook, page number wise, you can just go to this. So first is the function expectation. Okay. And the focus of healthcare quality. What is the function of healthcare quality? Expectations of patients, expectations of hospitals. Those points you have to read. Okay. And then dimensions. Okay. Dimensions of quality. What do patients perceive quality as? What does the hospital will perceive quality as? Page number 4. Okay. These dimensions are important. So read that. Understand that. Then cycle of quality control starts from page number 5. So from that, the main cycle, okay, measurement, assessment, improvement, that cycle. Learn that cycle. Then measurement, the first step of the quality control cycle. What are data? What is the measurement data? Different categories of data, types of data like absolute, ratio, okay? That categories you have to study. Tables are given, okay, in this chapter. So from that tables you will understand, okay? Then evaluation steps, displaying the statistical data and all, okay? Evaluation tools, yeah, how to which tools we can use for evaluating, checking uh, your collected data. Smart objective, specific, measurable, attainable, okay, rational and time bound. So what is the full form of smart? Page number 25. Okay, evaluation tools 21 onwards. Okay, different tools of evaluation. Some graphs and all is given. Okay. Then improvement steps, steps of improvement. There are 3 major steps and under that some sub steps have given. So read those points. Okay. Then models of improvement. Even in Six Sigma, models of improvement is there. Similar chapter is there in quality control as well. Okay. There are about 7 quality improvement models in the given the textbook in one page, front and back. Okay, so just go through that Kaizen blitz and all. Okay, 5S technique, 5I technique, Six Sigma, Lean. Okay, so all these names have been mentioned. PDCA cycle, Schwartz cycle, Fleming cycle. Okay, so those will come under quality improvement. Then when it comes to the chapter of medico-legal, all issues and all laws are important. The entire chapter is important. Question can come from any part of the chapter, especially the last page of this chapter, medico-legal, the last page. Okay. Res ipsa loquitur, those Latin phrases of laws. Okay. Those you have to be very careful. Okay. Some tricky questions can come from that side. Okay. So learn that well. Then you have patient management guidelines 43 to 44 onwards, how to manage a patient from an administrative point of view, from admission to discharge, different steps have been given. Just it's a read through kind of a point. Okay, so just read through it. International patient safety goals, very important. Page number 45 onwards. Okay, I have taken the classes for that. IPC, IPSG. Just focus on those recorded sessions, the main goals, and what they ideally carry, what lessons these each goals represent. It's important. Okay. Then you have spectrum of services. Again, points like admission, discharge, quality. Okay, it's given in certain points. Just read that. Patient rights, 11 rights. Okay, you have to remember the 11 rights of patients that you should know. Go through the quality standards just once. Read it twice. Okay, some conceptual questions will come from here. You will be able to answer. Okay, these questions from these chapters, quality standards and all, will be relatively very easy for you to answer. Okay, it will not be that tough questions. Second. Next, you have the organ transplant. 58 to 61. Okay, all those points are important, especially the counseling, okay, documentation, uh, the requisition, okay, what kind of communication should be there, okay, transplantation advocate, transplantation counselor, what are their duties, okay, what should they do, that all topics are important. Then blood transfusion, okay, guidelines of safe blood transfusion. Then surgical safety checklist, those checklist, just learn the checklist from online. Okay, in the textbook they have given the checklist in a very different form, not that easy to understand usually. Okay, so just search for WHO surgical safety checklist. You will get the 3-part pamphlet kind of a checklist, much easier to retain the knowledge from that. Okay, then you have medication management steps. How do you manage the medication, inventory control and all. Then medication errors, important, very important. Different types of medication errors, how to prevent it. Okay, what causes medication errors? These are the main topics from that. That is important. And sentinel events, definition of sentinel events. What are sentinel events? What do they represent? Okay, some examples of sentinel events, what is given, okay, in the textbook. That's important. Then you have the near miss events, 76 onwards, page number, near miss events. What is the main name meaning of near miss events? Some examples, okay. How do you document the near miss events? Okay, what is the standard protocol of work that you should follow while you're dealing with the near miss events? Okay, so that. Then PCI, that is your pollution control and prevention and control of infection, dust control, prevention of any renovation and construction that is going on. Okay, so how do you protect the environment, patients? Okay, some infection control and how to use gloves, gowns, mask. Some topic about your personal protective equipment is also given here. Just read once. Page number 78 to 79. These are quality standards of clinical practices. Just read once. Okay. Uh, Quality during end of life, quality during administering the pain medication. Okay, pain management quality standards. Let's read through it. Food safety important. The 3 levels of food classes, categories of uh, food classes. Okay, food hazards. Then facility management system. Just read through it. Okay, some points are given at the end of that chapter. Those points regarding potable water, electricity, and all those points are important. Then hazardous material, waste management, all the tables Okay, important questions can come from the tables. Then you have disaster management. Just read through it. It's a cycle of disaster management. That's it. Fire safety, full form of RAS. Okay. Main criteria of controlling the fire safety. What all equipments you require. What infrastructure do you require to ensure fire safety. Okay. Then TB control, there are 10 steps. Just read those 10 steps, understand the 10 steps. That's enough. Utility management, just read once. Water supply also, the tables and the points. Water supply required for per patient visit, per OPD visit, okay, per surgery, per inpatient. How much water is on an average is required. Okay, these things just read. Then accreditation, NABH, JCI, ISO accreditations, the procedures of applying for NABH, okay, the entire process, NABL entire process, those things. Abbreviations are very important here. Then power communication washrooms, how much washrooms are required, okay, how the telecommunication should be operated. When it comes to power generators, okay, how to have uninterrupted power supply, especially in which departments you cannot afford to lose the power, like ICU and all. Okay, so those things you should be aware of. Hand hygiene, just read through it. Everyone usually knows how to practice it. So hand hygiene, just read through it. 5 moments of hand hygiene. Then labor room, the table is there, not important for exam. This table is important for your practical purpose. Okay, when you're setting up a hospital and all, and you are setting up a labor room, delivery room, what all equipments, instruments, okay, furnishings, and other amenities that should be available in the labor room, that is given. You can use that as a checklist, that table as a checklist. Then ICU planning from page number 128 to 151, all the levels of ICU, stages of ICU planning, okay, ICU bed planning, how much average bed ICU should have to be functional, to be operating, okay. HDU, what is the full form of HDU? What is the meaning of HDU? How is HDU different from ICU? Okay. Waiting area, pharmacy, this just tables are important. That's it. HIV services also just tables. Whatever tables are there, just read through the tables. What is 5S model? Important. Okay. Sort, standardize, set in order, shine. Okay. Sustain. Then medical records department, read all the points once. Electronic medical records also, just read all the points once. Okay. Just I'm showing just 2 sample questions of quality control. You can expect certain questions that can come like this. Okay. Res judicata doctrine. What does it mean? The correct answer, 3 options will be given to you. You have to choose the correct answer. So here the correct answer is things have been decided. Okay. That is the correct answer. Res judicata doctrine from medico legal chapter. This question has come. Okay. Noise level in ICU at night should be. These are the options. Okay. If you have read the chapter of ICU, the facilities of ICU, what furnishing should be there and all, you will understand noise level at least below 40 dBA, elevated decibels, below 40 decibels, the noise level should be. Okay. Is it clear to all?